Welcome back to Washington Journal. We're joined now by Representative Rich McCormick. He's a Republican of Georgia. He sits on the Armed Services and Foreign Affairs committees, and he's the chair of the Science, Space, and Technology Subcommittee. Congressman McCormick, welcome to the program.
Thanks. Good to be with you today.
And the House is planning to vote on a Republican health care proposal. Can you tell us what's different about this plan? And I'm assuming you're going to be supporting it.
I am supporting it. You know, it's not as much as I want. We need a total revamp of the system, quite frankly. The Unaffordable Care Act, which has been a dismal failure, has increased premiums by at least 90% for almost everybody. Some people have had over 1,000% increases in their premiums. The insurance companies aren't being held accountable. They have a third of all claims are being denied, which is tremendous cost to hospital systems and healthcare associates. Meanwhile, they accept tens of thousands of illegitimate claims, basically on false Social Security numbers and false names. I once saw one of the people put through was Ken and Barbie, who qualified. It's pretty ridiculous, but that's what's been doing right now, and it needs to be stopped. Quite frankly, what we're going to do is change the way we supplement it so that it's not people who have over 400% more than the poverty level, who are millionaires who qualify through some loophole for these supplementations. We want to be targeted on the people who need it most. We also have to be sure that we reform the system itself. If we continue it the way it is, not only are you paying people who are millionaires from taxpayer dollars to have these same premiums, but also you're not fixing the problem. Look at these insurance companies. If you look at 4 of the top 10 Fortune 500 companies, 7 of the top 20 are either big pharma or big insurance companies, making tens of billions of dollars off the Americans' taxpayers' money because it's going to the wrong place. These huge hikes, nobody can explain why they're happening. Why are they increasing their premiums by 18%? Tell me. Nobody can. Big insurance sure can't, and we need to hold them accountable for the egregious things that they're doing to hold us hostage, both as consumers and as the American taxpayers.
So, Congressman, can you explain how this plan holds health insurance companies responsible and holds them accountable?
It doesn't. That's the whole problem. But what it does make things more affordable. First of all, it doesn't give everybody a silver or a gold premium plan. It makes it catastrophic. Just like you wouldn't use your car insurance to change your car oil or to change your blinker, which would be 10 times more expensive, forcing you to do that, as a matter of fact. This allows people to have catastrophic coverage where you have a health savings plan that would be funded in a different way where you can pay cash. The cash price is way cheaper. It's not negotiated through an insurance company that's basically holding you hostage. There's a reason that the big insurance companies don't advertise on TV. For example, in Wyoming, you only have one insurance carrier. That's a monopoly. And it happens all over the United States where we have a very non-competitive system where the insurance companies get to hold you hostage. When I was at my hospital system the last year, which was 3 years ago, we had several companies in the last year that basically couldn't come to the negotiation table with the hospital system. And we'd come to the ER. I'd have to transfer them to another hospital that did have an agreement, because that's how bad they're basically holding people hostage on these negotiation deals. It's not fair to us. It's not fair to the taxpayer.
So then, Congressman, where is the Republican plan that would hold the health insurance companies accountable?
Well, when you make it more competitive, that's one thing you do. First of all, by allowing small business to associate with each other and bargain collectively rather than individually. That does make it cheaper. I tell you, holding big insurance actually accountable is going to be hard, because you need 60 votes in the Senate to do anything. They love this issue. They don't want anything to pass. If you pass anything as a solution, they want the issue, not the solution. If you look at Warnock in his swing state in Georgia, he was the biggest recipient of health care dollars in his last run in 2020. There's a problem because people love big insurance. When it comes up here, the big lobbyists, follow the money, see where it's going, and you'll find out exactly where those people's votes are going.
As a medical doctor, I want to ask you about the quality of healthcare in America. A common refrain that you probably hear a lot is, we pay so much more for healthcare and we get less quality than people in other countries. Why do you think that is, and what's the solution to that?
Well, first of all, we don't get less quality. If you look at what we get here in America, it's the best. We're best at strokes, best at heart attacks, best at trauma. We do better work, but it's way too expensive. We're spending $5.7 trillion on healthcare this year. That's ridiculous. We are so out of whack. Once again, it's based on profiteering, on the margins that these insurance companies are allowed to take. They've trained you to use your insurance company when you go down to fill a drug prescription at CVS, which would be the same amount you pay in cash would be about your deductible. Plus then you add all the insurance company, what should be $10 becomes $100. We're trained to do that because you're always using your insurance company for everything. Like I said, the oil analogy. If you use your insurance company to change your car and your oil in your car, it would cost about 10 times more. We need to get over that. We need to use it appropriately. People have to have control over their lives, be able to make decisions and have options. Right now you have no options. It's overregulated. Interstate commerce is the way that they make us sue, but it's really not an interstate commerce issue because these insurance companies literally have monopolies inside of certain states. And if they do have competition, it's very, very little.
I want to play you a portion of Senate Minority Leader Chuck Schumer's remarks yesterday, blaming or criticizing Republicans on the ACA, and then get your reaction.
Republicans are the ones in charge. Republicans have the majority. There is only one reason in the world why these ACA tax credits are expiring, and it's because Republicans have chosen to let it happen. It's not that this choice was just not meant to be. This is a choice Republicans have made, Speaker Johnson, and people back home will suffer the consequences. Republicans can pretend this health care crisis is not their fault. They can give all the speeches they want about how much they hate Obamacare, but Republicans are the ones in charge. The health care crisis is squarely on Republican shoulders. Democrats warned Republicans months ago that this crisis was coming. We gave Republicans 13 chances to avoid the calamity this year, and each time they said no. The consequences, unfortunately, will be very severe back home.
Congressman McCormick.
This is such a dishonest argument. He's literally saying the Republicans are responsible for what we passed. They passed the Affordable Care Act, which is totally unaffordable. They're the ones that had the expiring supplementation, which they voted for 100%, not us. We were not in control when these things were passed. Now, he's saying it's your fault we're not continuing a failed process. Well, that's true. But every time we come up with a solution, they voted down because you know the Senate needs 60 votes. So when they say we're in control, we don't have a supermajority. We need a few Democrats to cross over and say, let's come up with something better. But they don't want to solve this. It's such a dishonest. They want to pretend that it's our fault for not correcting their problem. And they block any kind of solution. Every time we come up with a solution, they're like, nope. They don't have any interest in solving this. They don't even want to have a compromise on who receives that money. We want the poor people to be helped. We want to drill down on those people who need the help. We don't want to supplement millionaires. We don't want to supplement people who have 4 times more than the poverty level. We don't want to supplement people who are companies who are robbing us, who are accepting tens of thousands of illegitimate claims. That is ridiculous. The fact that they won't work with us for any solution shows you exactly, we've had 2 very good solutions. They voted against it. All the Democrats voted against it with maybe a couple dissenting, but if you're looking at, he says we're in control. We're not in control. You need 60 votes. That means you need Democrats. They have no interest in solving this. They want the issue, not the solution.
And I'll let our audience know that they can join our conversation. You can start calling in now if you'd like to talk to Representative Rich McCormick, a Republican of Georgia. The lines are Republicans 202-748-8001. Democrats 202-748-8000 and Independents 202-748-8002. Republican moderates, Congressman McCormick, were looking for a vote on at least temporarily extending ACA subsidies. Would you have supported that? I know the Speaker has said that that is not going to happen, but would you have supported at least allowing a vote?
No, not on what's going on right now. It doesn't make any sense. That's admitting that it's working. It's not working. If you want to supplement it for the people who need it, not for all these people who are basically millionaires.
So then you would support if there was an income cap? You would support
yeah, if there's an income cap, and not just an income tax, because remember, rich people can hide their income very well. I'm talking about assets. I'm talking about people who have tremendous wealth, who are receiving the same supplementation as somebody who has no assets. That's not fair. That's not fair to the American people to do that. And not only that, but we have to look at where the money's going. Why are insurance companies increasing their premiums by 18%? Why? Tell me. Nobody can explain it. Is it because all of a sudden it became more expensive for them? Why did it become more expensive? Because of the waste, fraud, and abuse? Probably. Let's get rid of that. Let's actually have a solution that drills down on that. We have several that are going to help with that. Deregulation, getting rid of all the false claims, making sure the insurance companies actually have to do the pre-authorization, which is standard care, which they're denying. I actually heard of a case recently where they basically said they had a claim for a biopsy that they pre-approved. And when it came back negative, they said, we're denying it now because obviously you didn't need it. That's what they're getting away with it. And that's ridiculous.
So have you heard from any of your constituents about who are on the ACA currently who are worried about these subsidies expiring?
Very few, actually. My district is unique, but I think most people want to see, they're all concerned. All my constituents are concerned about the healthcare premiums because they've seen since the Affordable Care Act that they've gone up a minimum of 90%. Some of them well over 1,000%. Everybody's concerned about that. Is the single biggest cost to Americans. A family of four is now paying $30,000 a year for insurance. Are you kidding me? It's the biggest expense to government, single expense. It's the biggest inflationary cost to all Americans. It is the second biggest cost to all businesses. It is taxing you over and over again. I've been talking about this since before I came into Congress to McCarthy when I said, let's make sure we address this one issue. I've been singing this song for a long time. That's why I came into Congress, because I wanted to fix health care. Unfortunately, you have a bunch of senators up there playing games instead of trying to solve a very real problem.